Well, if you're dealing with an ache in your knees or your hips that just won't go away, our next guest likely can help. The Jacksonville Orthopedic Institute has some of the latest technology that can allow you to return to the active lifestyle you once enjoyed. And Dr. Brett Frykberg is part of the JOI team. Dr. Frykberg, thanks for joining us today.
Thanks for having me.
We understand that you specialize in hip and knee replacements as well as revisions. So do you want to talk to us a little bit about what you do?
Sure. I'm from the area, first of all, and I came back here to do my general orthopedic residency here for about 5 years. And then I trained up in New York City at a place called Hospital for Special Surgery, which happens to be the top hospital for joint replacement in the entire world. So it really opened my eyes to not just the standard hip and knee replacements, but really treating that younger, more active population with hip and knee replacements, or high-end technologies and innovative procedures such as computer-navigated hip and knee replacements and robotic surgeries and such.
Yeah, so let's focus on that for a second, because there's lots of orthopedic surgeons out there that perform hip and knee replacements, but there's some things that make you different. Talk about your approach.
Right. So the difference for me is really the training. I trained with high-end technologies and also with the physicians who were actually the innovators of the hip and knee replacements back in the 1960s and 70s. It's really basic principles as well as the latest and greatest proven technologies out there. So we perform a whole host of hip and knee replacements with different approaches, and all to help the patient individualize their own treatment plan and get back to an active lifestyle.
Yeah, so you're talking about technology and how it's a big part of your approach, cutting edge technology. What are some of those surgeries that you've performed using cutting edge technology?
Sure. It's so for hip and knee replacements, we use a lot of computer navigation, which just allows for more accurate placement of the actual components. Robotic surgeries in both partial knee resurfacings, and I'm even trained in robotic hip replacements. Another surgery that I do that's not really mainstream is a hip resurfacing arthroplasty as well.
Go ahead. So tell us about hip resurfacing a little bit.
Well, as you can see in this video, this shows what a normal hip replacement is. It's cutting off the head and the neck and preparing the cup, so to speak, and that completes a total hip. Now the next part of the video shows the difference in what a hip resurfacing is, really for the younger active population. It just shaves off the femoral head, prepares the cup in the same manner, and caps the femoral head like you would crown a tooth. It's really a bone preserving procedure as seen here. Patients do extremely well with this. There's no hip limitations afterwards that most people are very scared about when undergoing hip replacement surgery. There's less thigh pain. People return to activities at a greater level. People return to running at a greater level. And these are all well-studied things.
Yeah, so what are some of the maybe reservations and anxieties that someone may have, whatever their age is, about hip resurfacing?
That's a good question, and I think that people tend to lack information, lack knowledge about the procedure, or that the procedure even exists. The procedure is slightly longer. The incision is slightly bigger, which is big in today's world. So people are kind of drawn away from it in that respect. But all the positives that I mentioned earlier, help the patient weigh the benefits and the risks when undergoing any of these procedures.
Sure, and you mentioned customizing a plan for them depending on what their condition is. So what advice would you give to someone who may say, I might be a candidate for one of these, but I'm not sure?
Well, good, and knowledge is power, so to speak. So I advise anybody thinking about doing hip or knee replacements or with hip and knee pain and want just someone to talk to, sit down with your orthopedic surgeon, sit down with me. I'd be happy to see you or your family and talk about this to see if they were a candidate for it. Also, the internet, joi.net, has all the information on the procedures that we perform. And
all right, very good. Well, we appreciate you joining us today, Dr. Frykberg, for all the great information.
Thank you.
We'd also like to thank the Jacksonville Orthopedic Institute for sponsoring this segment. You can learn more on joi.net.